Hello viewers and warm welcome to Alpha Morning Show. Of course, you are watching Alpha Morning Show, a show of a variety of topics that brings you across South Sudan. Live in our studio here in Juba, capital. Today we are trying to look at actually one of the spreading and looking at it very vital in South Sudan today, across the country, and wherever you are, just join us. Please try to tune in on Alpha Morning Show. We are trying to look at actually the polio vaccine that is supposed to be, and in which it had almost taken the last 3 days on distribution of this medicine to the young people looking at the age of 5 and below, and the mothers who are holding children in the womb, having the stakeholders looking at actually the Ministry of Health that is concerned, taking a drastic measures to take this action, making sure every child is being distributed with this means from door to door, and houses looking from national level to Payams, Bomas, and the counties. Having in the studio an expert from the National Ministry of Health with me in the studio will be able to elaborate more on how these the drugs distributed, and looking at also the concerned people. Having in the studio who I have George Rain, who is Lege from the Ministry of Health, will be able also to tell us a lot on elaborating that. And with the agenda also today here, we got Mary Dennis Abud, who is an education and promoter, is also a director. I think she will be able to tell us more on how this information is being disseminated from the national level to the state level up to the Payams, Bomas, and the counties. A pleasure having you on board in this program today, and nice having you on board.
Thank you very much for hosting
But
us.
I think straight away, Mary, you would be able to tell us what is this polio means. What does it mean to the people of South Sudan? Many people hear polio, polio, polio. They may not be knowing what polio is. Can you try to elaborate and describe what polio is exactly to the people of South Sudan? And sometimes they having these drugs being given to the young people at which age, sometimes they may not be knowing. Mothers are also giving birth to children with polio. They may not be knowing. Would you be able to define clearly what it means to the people?
Yeah.
Then I think we will have...
Okay, thank you very much, Soro. Actually, polio is a very, very dangerous disease, and which affects children, young children. So actually, once the virus gets into the body, it can really affect the nervous system, and that is where the paralysis come in. It affects it damages the nervous system, and then from there it paralyzes the child, and even it can lead to death. So either you are paralyzed or you're dead, and it is not reversible. Once the child is paralyzed, that will be for life. That's why we say there's no cure, but the only way to prevent it is through the polio drops.
I think polio is among the 6 killer diseases that affects young children, small children that are on actually their livelihood from birth to 5 years of that age, isn't it?
Yeah, sure.
Great.
Yeah.
I think let us hear another definition from also Mr. George Lege. I think you'll be able to also tell us what clearly it means to the people of South Sudan, especially the mothers who are mostly concerned of children and looking at those who are actually in the parental care of these kids from the age 1 to 5, as it is actually the concerned age that needs a proper care, and even the mothers with their pregnancy at the same time, I think they also undergo that.
Okay, thank you. Once we say polio, automatically to all mothers, the paralysis will come to their mind immediately. Why? Because the polio is paralyzing the children, especially from under 5. Is the risk target or age. Sometimes will go up to 15 years of children will be paralyzed. Those who are reaching to 15 years who are not being vaccinated, they don't have the immunity against the polio. I think this is in summary.
Well, what could be some of the signs and symptoms of this polio that ignites to the perpetrators?
Okay, thank you. The sign and symptoms. For polio, as my colleague mentions, the route of transmissions, the polio entering the body through mouth, through one, the water that was being contaminated with the virus, and the virus there are 3 types, type 1, type 2, type 3, but type 2 was being eradicated from the whole world. What is now disturbing us, especially in Pakistan, just Asia, is type 1 and type 3. For us in the whole Africa, the 3 types was being eradicated, and we are now using, being disturbed with something called CBBD. Is something that affected the children who have a lower immunity. So it's the one who now disturbing us. But the real wild polio.
How did that lower immunity come into existence? Because it has become a phenomenon. How did it come into existence? Because is it because of the environment, or is it because of looking at the environmental factors? I think is one of them also. I think would you be able to elaborate that?
Yeah, when we're talking about the lower immunity, the country like South Sudan, we're having many challenges to reach the target. Okay, because we started from up, let me just take you a bit back. The immunizations program, one of the main objectives of the immunizations program to vaccinate the under 5 children. The purpose for the vaccinations to reduce
the rate,
the morbidity and mortality rates. That is it. So to have good immunity, at least you have to reach 90% of the children. But because of our situations in the country, we're having the hard to reach areas, we have the insecurity. Sometimes there is a children we are not able to reach them with them with the vaccine. So when those children missing the vaccines, automatically they will not have the immunity.
Mr. Legge, how many cases have you so far registered? Cases that are actually looking at cases to do with death rate, to do with you are looking at actually preventive measures. These are the drastic measures that you have taken as a National Minister of Health in conjunction with the states, spearheading and holding other states, including the administrative areas at the same time. How many cases have you so far registered?
Yeah, up to now we're having 9 cases. The 9 cases from different states, I don't have the statistic or the list. But the first one, in December 2023, the first case was in Western Equatoria, Yambio County. And then after that, moved to Juba. For Juba, we're having like 3 cases. And we're having in Juba, also there is a cases being detected from the environmental, the sewage. Because we are taking the sewage. Every month we're taking the sample from the sewage, from the environment. So that's to tell us that, because once we don't have any case in the environment, especially in the sewage, it's telling us, yes, now we interrupt the spread of the polio.
Right. Let us also try to hear from Mary. Mary Dennis Abuk, you are there for education. Looking at the Minister of Health, what is the role of educating the public, looking at the national level to the state level, now that we have also 10 states, and looking at the administrative areas? How far have you so far gone with educating the public, knowing on this distribution of the medicine and immunization, looking at also the PIAMs and the BOMAS as far as the policies of the Ministry of Health is concerned in a high level of drastic measures into prevention and looking into this issue?
Yeah, thank you very much. Actually, at the national level, we are the one that are responsible for the guidelines and for the policies.
Mm-hmm.
And we also, with our partners that are supporting
Mm-hmm.
communication,
Mm-hmm.
we make sure that we have a comprehensive communication
Great.
strategy.
Great.
Yeah, and for each different diseases, we have communication strategy. For polio specifically, we also have it, even including strategy for the cattle camps.
Great.
So in that strategy, it is, you know, stipulated very clearly how, you know, the campaign should go down, trickle down up to the lowest level, from national to state,
States,
and
Payams, counties.
yes.
Mm-hmm.
And we make sure that we have trained volunteers, okay, who will do the job. Like this campaign now, it is house to house or door to door.
Mm-hmm.
And then we make sure that we train these volunteers, you know, I mean, for them to go door to door and give the drops, the polio
in a
drops to the
professional
children.
way.
Yeah, in a professional way. They've been trained.
Mm-hmm.
So our job is to make sure that the parents understand the importance
Okay,
of
as far as the
vaccines.
policies of the ministry is concerned, what type of staff do you categorically train to actually look into this dissemination of this information and looking at also distribution of the message that's sent to the perpetrators and the victims concerned?
Yeah, these are the community mobilizers, we call them, community mobilizers. And they've been trained in different diseases, including polio. So they have been oriented, and they know what to do. They know how to give the drops. And they know also how to convince the caregivers, tell them that this medicine or vaccine is very crucial, important for your child, because it will prevent your child from getting, you know, I mean, yes, especially vaccine preventable diseases, including polio.
Let us try to, Mr. Lege, you are the director in the National Ministry of Health, looking at actually for heading this this disease and looking at the preventive measures. The Ministry of Health itself does not work alone. The Ministry of Health works in collaboration with the stakeholders, that is to say World Health Organization, we got the UNICEF, and to mention but a few. How far have you gone with these stakeholders into implementation of your policies as it's concerned, from the state level, counties, Bomas, and the Payams, as far as South Sudan is concerned, of having 10 states, including the administrative areas?
Okay, thank you. Yeah, I think, as you put, UNICEF and WHO is our main partners, and especially this polio. UNICEF, WHO is the one who declared the eradication of the polio. So UNICEF, WHO is our partners. We are working together from the beginning. Like when you detect the case, we'll start sending by support from UNICEF, WHO, and we'll send to the lab, because we don't have the lab that testing the polio. We are sending outside in Uganda or Kenya, but now we are dealing with Uganda. So when the results come positive, we'll come together and sit and make a plan and raise it to the polio, global polio initiative, eradications, then we'll get the funding. So the fund will come, part will go to UNICEF. UNICEF is responsible for logistics of the vaccine, from the purchasing of the vaccines until the last mile delivering to reach the state or the county. These are responsibility of the UNICEF. UNICEF also responsible for the communications. The money will come, will go to the UNICEF, and they will be responsible, working with Mary together for communications, preparing of the messages, and send them. For WHO side, it's a technical. WHO will start work for micro planning, because for everything you will not go like this. We'll start putting the plan, because we have the national plan, we submit it to the global level. After that, we'll go to the micro plan. The micro plan will move to the state level, state counties, counties PAYAM. Within the PAYAMs, we'll go to the BUMA level. Based on the formulas that we will put, how many children will be vaccinated per day, per team, will give us the number. Like now, these campaigns, we're having more than 8,000 teams is going to work nationwide to reach the children. Our strategy is house to house. So this is how we are working together. WHO is responsible also for the training of the vaccinators. Yeah, the trainings of the vaccinators, so that we'll have the quality vaccines and the right way of giving the vaccines. So this is how the role and responsibility being distributed. Minister of Health is the pillar here.
Oh, great. Let us look at also. Let us look at also, Mr. George. South Sudan is a member of East African Community, and you did touch something a little bit to do with headquarters and in collaboration with the neighboring countries. That is to say, South Sudan majorly today, the origin of this vaccine being distributed to the national level, coming with your policies to the state level and going to the grassroots. Let us look at the counties, Bomas and Payam's outreach. And how do South Sudan having the headquarters and being in collaboration with the stakeholders?
Yeah, I think as you put, how South Sudan is reaching up to the outreach. We are working with the regional level. For us in South Sudan, we're under the East Africa. And WHO having its divisions. South Sudan is under the South and the regional Southern, East African and Southern African countries. Their headquarters is in Harare. They are the ones supporting us technically. And the plans, everything, so we prepared and then submit to them first. After that, they will raise it up. This is how we have been working. For the outreaches, normally we have routine. As I say, we started from down. Polio, normally for routine, they need 4 doses. We call 0 dose. Dose number 1 will come when the child having 6 weeks, and dose number 2 will come when the child having 10 weeks, and dose number 3 will come when the child having 14 weeks. Like this means the child have finished their schedule. They are now having a good immunity, the extent of 80% immunity. So how the children or the parents will get the vaccines? The vaccines normally will be in the health facilities. This we call in the routine. There is health facilities having the fridges, the vaccine is there, the mothers will bring their children.
Okay, we will come.
But we're having the hard to reach areas, we will reach them.
We will come into that, Mr. George. Mary Dennis, you are there for education. Of course, some of dissemination of information is your role, is your key role playing actually into disseminating information from national level, state level, Payam, Bomas and the like, I think in collaboration with streamlining the states. What do you think are some of the challenges that you are going through in disseminating this information to the up to the grassroots? Okay, so
we have a lot of challenges when it comes to disseminating information, especially in hard-to-reach areas.
Exactly.
And areas where there is no reach of radio stations and TV. So that's why we use community mobilizers. And by the way, we have integrated all the community mobilizers or community volunteers into Boma Health Initiative. and this one is a program of the government. We wanted to have all the community health workers under the Boma Health Initiative, and we call them Boma Health Workers. And those are the Boma Health Workers are actually based placed in the lower levels, up to Payam and Boma levels, because we are going to use them to disseminate information down there, where the people cannot have reach of radios or TV and all this. And also we have IEC materials that have been developed, and we cannot translate them all into 64 tribes of South Sudan.
Mm-hmm.
So we actually do like at least 2 languages, English and Arabic.
Mm-hmm.
Yeah, because there are other places that, you know, they are more Arabic than English. So because it will be waste of, you know, funds if we just resources, if we do a lot of, you know, printing of all, a lot of materials for no reason.
Do you always alert the public in advance in such situations? Because looking at the actually dissemination of information to the public up to the grassroots is quite difficult. So as you did mention that nobody, not everyone in South Sudan, including all the 65 tribes, watching the television and radios in dissemination of information, because in advance, some people do not know when this medicine is supposed to be distributed to the people, to the outreach. What methods do you have? Do you do it in advance, informing the public, and in advance using the communities?
Yes. For example, like this campaign now, we have social mobilizers that go around, you know, announcing about the upcoming campaigns 3 days or 4 days before the campaign starts. So this is the role of social mobilizers. We have social mobilizers who do that. Announcing and telling the families that there will be campaign, will be coming to your home, door to door. So, but going back to, you know, dissemination of information, like I said, there are other areas that are hard to reach, but we is still using some radio stations that can reach to all, I mean, not all the entire country, but at least it can cover most of the states. For instance, we have radio, iRadio, and
that covers
probably
the whole country.
Yes, probably Meraya. But again, the challenge is some areas may not have.
Comes to an
some
area
areas.
to you know, as people are language barriers in the whole country. Not everyone listens English and Arabic.
Yes.
Coming to dissemination, not a few people also listens to to radios and watching television.
I agree. I agree.
What could be some of the mechanisms that you could take in place to eradicate that?
Yes. So what we do is we translate. Not translate, let's say we have radio jingles, recorded messages that are translated into at least 10 languages or local languages, South Sudanese local languages. And that way, then people will be able to listen. That's why I said materials, producing a lot of materials will be waste of you know, resources. So we invest mostly on public service announcements as well as radio jingles translated to the different languages.
Great viewers of Alpha Morning Show, if you have just joined us or if you have just woken up across the country, wherever you are in South Sudan, we are bringing you this program live here in our studios in Juba capital. Of course, we are going for a short break, and we will be right back as we are discussing issues to do with the polio vaccine and how it is distributed from the national level, state up to Boma, Payams, and the whole country, as well as being a collective responsibility of families to respond towards the distribution of this medicine to the particular people age of 5 and pregnant mothers that are responsible. Try to stay with us, don't go away. You are still, we are still with you on Alpha Morning. Stay with us. are still watching Alpha Morning Show, of course, my name is Soro David, and viewers of Alpha Morning Show, if you have just joined Alpha Morning Show on this part of our conversation as we are discussing on issues to do with polio vaccine that is being distributed countrywide. And if you have just joined us, please try to be following us also on the social media, SSBC, Facebook, and at the same time, you can also follow us on YouTube official on the social media. You'll be able to be following us as you have just joined us. You can start out from right there, and we are bringing you this program live in our studios right here, and still continue with our polio disease and the vaccination, at the same time having us with the full people, the stakeholders with us here from National Ministry of Health, elaborating more on how this disease to be eradicated among the people. Mr. George, you are a director from actually National Ministry of Health. We were looking at actually things to do with challenges after this mentioned. I think you'll be able to tell us some of the challenges being a policy maker from your ministry up to the state level, because it has not been easy the last 3 days that this distribution of this medicine, looking at from national level, state level, and PAM level, and looking at also your stakeholders that you're working hand in hand in actually in distribution of this medicine and your response towards that.
Okay, thank you. Yes, I think the challenge for the distributions of the vaccines, one of the bigger challenge to us is the transportations. You know, South Sudan is having the hard trains. The train was not good. All the vaccines going from Juba to the state, we are using flight. Mm-hmm. So this one of the things become very expensive. And even the plan of the flight sometimes is not going every day. We are using UNHAS and some commercials also. So these are a bigger challenge. And also there is some counties they cut off from the headquarters of the states. So it means that you need to transport the vaccines from Juba direct to the county. Means like the vaccine supposed to be taken from Juba to the headquarters of the state with the $1,000 US, but if you're going direct to the counties, means we will go to the 5,000. So become very expensive, and the issue of the funding become an issue. But thank God we are trying the best with our partners.
The stakeholders?
The stakeholders, yes. Mm-hmm. Other challenge is the hard-to-reach areas. Sometimes we reach vaccines to the headquarters of the county, and the vaccine to reach the last mile also need other vehicles to be hired, and from that side also the vehicles become very expensive. Let me give you the example like Jungule. Mm-hmm. Jungule having 11 counties, and there is 3 counties that we're reaching from the board, but the rest will send the vaccine direct, and from there also to reach the Payams and Boomers need the hiring of the vehicles, and the vehicles in that end is not easy.
But how difficult, Mr. Lege, how difficult does it come to that extent? Because now looking at this distribution of this, the medicine, the vaccine that goes to the people from the states to states and from counties, Bomas to Payams, don't you have that statistical number of the people living in the Payams and Bomas, looking at the state itself level? For example, Jonglei state having counties and Payams. Could yes. you have taken that as a statistical number of people rich in outreach of these people from counties, Bomas, and the Payams?
Yes, I think as I mentioned from the beginning, once we have a case, we'll come and sit down, starting planning. So the planning is start with the populations, we start populating the numbers of the people that in the area. For example,
short term, long term?
For campaign, it's the short term. You will just do this campaign based on the population that you will gather, and then make the calculations. We have a formulas how to calculate to bring the number of the team by the population. So from there, this is where we'll request the vaccine. I told you from the beginning, from national level, we are using the just total populations. We'll calculate and then send to the donors to give us money and the vaccines. So based on that population, this is how the vaccines and the other resources will come. We'll go down the same way. We'll calculate the number of the state by counties, each county having a population. Like now we are using projected populations based on the 2008 census is our base. We'll use the projection because every year there is the projection, the growth rate of the 3%.
It is every year. How do you determine the mortality rate and the death rate? Because you're now talking.
There is a formula there. All these things, if you went to National Statistics Bureau, there is a formulas there being used. This is how we are using it. We are not just using it randomly. No, there is a formula, scientific formula. We are using it. This is how we are getting the target and the population, the vaccines. This is how we are distributing the vaccine. We're distributing the vaccine according to the populations that we get from the county. And the county, the same from the county, there is a detail of the payams.
So despite all these challenges, what could be some of the mechanisms in place that you have tried to take drastically to make sure this is put in place in distribution of these drugs and looking at the perpetrators?
Yes, one of the mechanisms, yes, this is what I'm explaining, the gathering of the populations. Once you have the good number, you will know that that area having a people, because it's hard to reach, but because there is a people there, we have to try our best. Although it's expensive, we'll send the team there. Especially, I don't know if you have been following, we have been doing the campaigns during the dry season. One of the strategies, we are targeting the dry season so that we can able to reach the hard to reach, especially our situation that we're having a flood every year. So those who are not able to be reached, we reach them. And those who are in the islands, we will reach them with the boats. So these are the strategies we are putting to reach all the populations. Because as I mentioned from the beginning, at least we'll have the 90% above coverage so that we can able to.
Great, let us try to hear from Mary. Mary, you are now representing South Sudan here as a mother, first and foremost, and looking at actually mothers, they play a very crucial role in such situation, because in any situation that happens in a country, mothers and children are victims of any circumstance. Yes. What is your responsibility as far as a mother,
woman as well as a mother,
spearheading this polio vaccine to the young people? You are a mother actually,
yeah, sure.
Representing the Ministry of Health as far as your vicinity is concerned.
Yeah, I think yes, mothers are the one in charge of the children, these young children especially. But again, I also encourage the fathers to also support the mothers when it comes to caring of the child and when it comes to vaccination of this young child. Let it not be left to the mothers alone. We are encouraging fathers to help, because in all these campaigns we have been involved in, it has come to our attention that sometimes some of the fathers, they don't give a chance for the child to be taken for vaccination. They want permission. They want to give permission to the mother to take the child. So we have found out it has been happening in the community. So we are urging the fathers to really support the mothers, especially when it comes to that. Because this child is for both of you. You brought this child to the world, both of you. So that support is very important.
What do you think could be some of the mechanisms in place, looking at the actually irresponsible fathers who are not taking care of not actually looking at this being responsible for the kids in response towards actually this vaccination and actually being allocated to them.
Yeah, that's why there is a fathers to fathers support group, because we already have mothers to mothers support group, and good enough some husbands, some men have come up to support their wives to even to take the child for vaccination when the mother is not feeling well, or when the mother is overwhelmed with other activities in the house. So it's been happening, but it's a slow at a slow pace. So we hope fathers will continue to understand the benefits or the importance.
That is actually great. I think
let
us try to also alert the people outside. There are viewers of Alpha Morning Show. If you have just joined us, or we are still with our program here live in our studios. If you have just joined us, please try to follow us on the social media, SSBC official, and looking at the also YouTube, Facebook. I think you'll be able to be watching this program, though we are trying to wind up. You try to be with us every Thursdays and Tuesdays from 8 to 9. Mr. Lege, you being actually the director concerned looking at this dissemination of this info that is the responsibility of Mary, and at the same time you being a director from Ministry of Health, looking at the policies, and we have talked on issues to do with what do you have to wind up on this, taking a collective responsibility of the citizens in South Sudan and the masses, wherever they are among the 10 states, including the administrative areas and the major towns, that is Juba, Wau, and Malakal, in these major towns, and looking at actually South Sudan as a whole country.
Okay, thank you. Yeah, I think from my side, first I want to tell all the parents, mothers, guardians, that the vaccine is safe. The vaccine is safe, and the vaccine saves life. We need them to accept their children to be vaccinated, because once the children being vaccinated, the children will have the immunity against the polio, means their children will not be paralyzed. I don't know for those who have been seeing, I'm somebody who grew up in Juba here, those days when we are small.
Still kids.
There is many children being paralyzed. We call it Abu Kereng. To the extent people start, when those who having the problem in their legs moving, we start playing when they are going Abu Kereng Mata Kasokra.
Great.
So now these things have disappeared. Because of what? Because of the vaccines. So I'm just asking all the mothers, parents, guardians, let them cooperate. The government is working with the good and the benefit.
So to ask you in 1 minute before you conclude, I think previously, before this medicine, the vaccine was introduced, people who grew up with this disease into themselves not immunized, is that the cause?
Yes. Yes. This is why those days we're having the higher rates of the paralysis children. And why? Because the vaccine is not there. The vaccine is not there, and after the eradications of smallpox, and then the idea of the
chickenpox,
smallpox. So the idea of moving to the other vaccines came when we're starting with the 6 childhood disease, and then we continued. Now we're having more than 12. For us in South Sudan, we have 8, and in April we'll add another 2. Will become 10, plus malaria vaccines become 11. So every year, this is why the program was being named Expanded Program on Immunizations. Every time, every year, there's a new vaccines coming to protect. Now, those days we are saying the childhood disease, but we change the name now to vaccine preventable disease. I see. So, means the vaccine saving life. So, like this called what? Kot, whooping cough. Those
whooping
days
cough, yeah, sure.
was
rampantly
everywhere. But we are not seeing it now. Why? Because of the
this vaccine, yeah,
yes.
sure, absolutely.
Yeah. So I just want to tell the mothers that the vaccine is saving life and the vaccine is safe.
They should respond into that.
Yes.
Great. Let us finally hear from Mary, dissemination of information and looking at actually you are taking a key role into playing a key role into alerting the mothers and children being concerned on this process that is going on today.
Yeah, thank you. I just want to pass information to the public and especially the caregivers of children, below 5 that are susceptible to polio. I just want to, I want to alert them that it's very, very important at this time when the campaign is ongoing. Make sure you bring your child make sure your child is available for vaccination because the teams are coming house to house. So don't hide any of your children that are eligible for vaccination because there are some parents that hide because they think that vaccines are not good and they are dangerous, they can lead to other diseases. This is not true. The vaccines are safe, as it was mentioned by my colleague, and they are also effective. And that's why nowadays the children are healthy, and they can be able to go to school. They don't have any paralysis, and it's because of the vaccines.
Sound mind.
And yes, and I'm just urging them not to listen to those people who are against vaccine, anti-vaccines. They are all over, whether it is in the social media or in the communities. Let them not listen.
Thank you so much. Viewers of Alpha Morning Show, that was from the National Ministry of Health, information, dissemination of information to the public, and at the same time looking at the distribution of this medicine, vaccine that actually targeting the mothers and the children that are mostly actually getting affected because it's among the 6 killer disease that is very dangerous, and mothers should respond towards that, and the father's responsibility. It is actually a collective responsibility to the people of South Sudan as far as that disease is concerned. Polio, wherever you are watching us, we have come to the end of this program. Continue watching the rest of your programs of your national broadcaster. My name is Soro David, your host, your usual presenter. Thank you.
Thank you very much for hosting us.
Thank you, Mr. Lege. Yes. Thank you. It's okay. It's okay.